So you have obstructive sleep apnea or sleep disordered breathing, and you've exhausted conservative management, and you've decided that you're going to go forward with jaw surgery. Now the looming question is, how do you choose the right jaw surgeon? This is an incredibly important question that I'm so happy you're asking, because it can save you a lot of time and energy and suffering in the long run if you do your due diligence now, and you don't have to backtrack or redo certain things or live with certain complications through the rest of your life. This is an incredibly invasive surgery that has so much potential to help you. So you want to do everything you can to stack the deck in your favor and make sure you hire the right person to do this job for you, because different surgeons are better at different types of demographics and cases, and you want to make sure you choose the right match for you. Jaw surgeons, not all jaw surgeons are created equal. They are people. They think differently. They're trained differently. They have different personalities. Some are risk adverse, some are more conservative, some are aesthetically driven, others are way more airway, conscious. So all of these things matter. And if you remember this as you go forward, it'll help you ask better questions, and it will help you protect yourself, because that's really what this is all about. You want to make sure you're doing everything you can to protect yourself and get the best outcome while protecting yourself. This is a process. In this process of finding the right surgeon, we're just going to go over step 1 in this video, which is doing your research. At the end of this first step, you want to make sure that you have a list of at least 3 surgeons, maybe up to 5, who you will then schedule in-person consultations with. So let's go through step 1, doing your research. You're going to start with a list of yes, maybe, and no. And you're going to keep adding to that list or modifying as needed as you go. So you're going to do 2 searches. The first one is your preliminary search, which is going to include an internet search and speaking with different providers who come into contact with many different patients from many different providers, many different surgeons. So they get to see both short-term and long-term results of patients. So if you already have a network of kind of airway-related providers, whether that's your orthodontist, your myofunctional therapist, your physical therapist, I would start there. Ask them, in your case, if they have any recommendations for surgeons to speak with in person, and also if they've seen certain surgeons who results are inconsistent or not ideal. That will at least give you a better track record to start with of up close, consistent pattern recognition from different providers. The internet search is going to involve going through the jaw surgery support group on Facebook. And then I believe there's a couple other Facebook jaw surgery groups that I would look for. Also searching Reddit and connecting with patients that have had surgery and have experience with various surgeons. So again, if you have providers to speak with, I would start there. But if you don't have that, I would start with the internet. So if you do have the providers, go provider and then internet, because you already have a little bit more of a filter at that point. And in this process, you are looking for reviews, you're looking for before and after photos, you're looking for basically anything you can get your hands on in regards to reputation and results. And you are going to also keep in consideration dates of reviews. So surgeons, because they're people, they usually get better at what they do throughout their profession or throughout their career until a certain age point, and then you potentially will see a peak and a downfall. So you want to keep in mind that maybe reviews from 15 years ago at the beginning of their career may be somewhat negative, or you find a couple negative ones, but then you keep looking and you realize, oh, more current dates over the last 5 or 10 years are actually all positive. This is great, and this is a normal process of providers or surgeons paying attention to their results and improving over time. So do keep dates in mind. If you find surgeons with mixed reviews, put them in the maybe, potentially to circle back to if you can't find enough yeses. At that point, you're then going to do a secondary search. So you should have, I'd say ideally 5 surgeons in your yes list. You could get away with 3 depending on how your secondary search goes. So ideally 3 to 5. You're then going to do your secondary search, which is going to be search each of those surgeons' names on Google and look for anything you can find, whether that's hidden patient reviews, Google reviews, different sources of where patients have the ability to review, maybe Yelp, though I'm not so sure about that one. And you're also going to look for lawsuits, and you're going to look for photos of before and after results with different providers. And then at that point, you want to narrow down to at least 3 providers. And the reason being, you don't want to only see 2 surgeons for consultations and then decide from there, because you have no idea where you lie in the landscape of surgeons, right? So you don't know by looking at 2 different opinions, you don't know if this guy is really conservative or this guy's really risky. You don't know enough questions to ask. As a patient, you want to get better at asking questions and understanding the procedure as you go. And doing that only twice, it's just not enough to make a good decision. So you want at least 3, potentially up to 5. If you have more than 5, you probably didn't do a really good job searching, and it's probably not worth your time to see 6 people or surgeons or more in person. But again, there's exceptions to that, especially if you have a more complicated case. So at this point, you have a list narrowed down, and your next step would then be to schedule in-person consultations with each of these surgeons. Virtual consultations just don't cut it. It's too difficult for a surgeon to see what you look like. You can only get, imaging. You can't see a person's body when you're online, which makes it harder to understand like the context of their face with their body and like their head posture, and it's not worth the time or energy to do it online. It makes more sense to do it really well and in person once. Hopefully this first step was helpful. I will follow up with a step 2. And if you have any questions about this first research part of the process, please find me at summerspt.com and send me a message there, or feel free to write a question in the comments below.